As Florida schools continue to figure out how to reopen next month, I-Team investigator Katie Legrone is now taking a closer look at the nurses on campus and why many schools are going to be forced to open without one.
It's a place we've never been.
Part of this is the fear of the unknown.
Schools preparing to welcome back students with new rules on masks, social distancing, and which symptoms prompt rapid response.
We're not going to take any chances.
This is back to school amid a pandemic.
We will see illness in our schools when we open them.
As Florida educators iron out how to open school doors to students during a health crisis, we've learned many schools will be doing it without a full-time certified school nurse on campus.
Obviously, a trained school nurse in whatever capacity on campus is the best solution.
Linda Kirshner is president of Florida's PTA.
We've had an active voice on that issue probably since the early 70s.
Equipping Florida schools with a full-time school nurse has been a decades-old fight. According to the Centers for Disease Control, schools should have one school nurse for every 750 students. In Florida, the latest state data shows it's one to more than 2,390 students.
That doesn't surprise me at all. I do know that's about what my schools consist of between the two of them, so it's not shocking to see.
Catherine Burge is president-elect of Florida's Association of School Nurses and works as a certified school nurse for the Hillsborough County School District, covering 2 to 3 schools at any given time.
How are we looking at returning students to schools amid a health crisis with school nurses not available at every school?
School districts really need to come up with a plan in place and make sure that there is someone with a health experience in the schools.
In Florida, school nurse certification is not a requirement on campus. And while many districts tout having a licensed practical nurse or LPN at each school, they lack the qualifications of a registered nurse who often cover multiple campuses at a time.
There are some counties across our state that have, some nurses have 5 or 6 schools apiece.
Lisa Kern is supervisor of health services for Pasco County Schools, where each school has an LPN, and of its 45 RNs, each one covers 2 to 3 schools at a time.
Times like these are when this inequity and in terms of the resources, a light is definitely shown on them. And it reminds us all of areas that we need to definitely improve.
Some districts now tell us they are using CARES Act funding to ramp up their roster of registered nurses.
Our I-Team is taking a closer look at district plans in the event a student or staff member tests positive for the coronavirus.
As I-Team investigator Katie Legrone shows us, many of those plans remain unclear.
My turn?
If you're a Florida parent, it's safe to say the choice to send your child back to campus this year remains nothing short
I'm still ahead of you guys.
of nerve-wracking.
We went back and forth a lot. Perfect.
For James Shaw and his wife, the decision boiled down to a deadline and an 8-year-old's desire.
She's had to hang out with mom and dad for like 6 months, and I wanted her to be able to be with her friends again.
For Barbara Mellon, it's life for a single working mom.
I don't have much of a choice.
But still a work in progress, what Florida school districts plan to do if a student or staff member tests positive for the coronavirus.
I don't have the what-if plan.
We surveyed Florida's 67 school districts and asked a series of questions, hearing back from just about half. Of those who responded, all will require the person quarantined for up to 14 days, what the CDC recommends. Less than 10 will mandate at least one negative test before the person can return to campus. And a handful plan to make the entire class get tested. But most school districts who we heard back from said if there's a positive case on campus, they'll seek guidance from their local health department.
And the idea that, oh yes, we'll just call the health department and they'll send someone over. I mean, it's pie in the sky.
Dr. Mona Mungat is a Tampa Bay immunologist and member of the Committee to Protect Medicare, which recently warned Florida's governor that without more safety measures, schools could become COVID-19 super spreaders. She's concerned most school plans rely on families to self-report symptoms, and health departments already strapped for resources and staff.
All of these school reopen plans are based on almost like a fairy tale scenario.
The hurt means you go again.
Leaving parents to play a game of chance.
Do I have concerns? I do. My wife does. We're nervous. There's no question about it. And yet I truly believe that they have our best interests in mind.
In addition to helping with case-by-case guidance, we're told county health departments will also help schools contact trace.
Days after the state vowed to share the numbers of COVID-19 cases in schools, they still have not done so. Meantime, my team investigator Katie Legrone shows us how more Florida school districts are taking matters of transparency into their own hands.
We absolutely recognize the importance of face-to-face education.
During a recent roundtable in Tallahassee, Florida's Surgeon General explained why a state report detailing hundreds of COVID-19 cases on school campuses and at daycares in August was abruptly taken down.
It was a draft that was inadvertently released, but we're in the process of making a report that will be final.
A report, he says, that will eventually be made public.
We're trying to put together what is going to be the best report that actually truly captures what the incidence of cases are in the state as related to schools.
Thank you. To date, it remains unclear how many Florida students and teachers in total have been impacted by the virus since the start of the new school year. But across the state, we've learned more and more Florida school districts are taking it upon themselves to post the number of COVID-positive cases in the classroom, offering the public more transparency than Florida's Department of Health. In Tampa Bay, Hillsborough County schools are breaking down the numbers by school and if the case involves a teacher or student. As of this morning, they had 156 confirmed cases. In Pasco County, the district right now is posting cases only by school and if it's a student or staff member. Its spokesperson says they'll also be adding total number quarantined.
We just decided from day one that parents need to know, and the public in general, I think, wants to know what's going on in the schools regarding COVID-19.
We've confirmed nearly a dozen Florida school districts are now posting school cases on district websites. Another 8 we heard back from are either developing a page or discussing if they will. Duval County Schools in Jacksonville was forced to put its page on hold. According to a spokesperson, it's waiting for Florida's Department of Health to give them permission to publish the information.
Have you received any pushback from the health department, be it the county health department or the state?
No.
In Charlotte County, they didn't ask, but when the first case comes, they plan on publicly posting everything from who tested positive to the school, grade, and the number of people quarantined.
We're not naming names. We're not going to do that. But I think it's important for people to know the brutal facts. We need to be open and honest and have all the information we can for parents and community members,
including if the person shows symptoms, something the governor said he wants included when the state releases its information.
I think that needs to be in there because I think these cases get spun as if they're clinically significant.
For most school districts, most significant is getting their own COVID numbers out.
We've all decided that transparency is the way to go.
Once you start posting, you'll be more transparent than the Department of Health.
Well, we'd like to be that.
The state's top doctor didn't say when his department will release statewide school data, but did say it could take weeks or a month.
Untested and uncounted. Tonight, the I-Team discovering why COVID-19 cases at schools all across the state of Florida may be flying under the radar. Investigative reporter Katie Legrone leading us off here tonight with the testing gap that is not showing up in the current numbers.
1 week after school started, COVID hit home for Amanda Bryce's family when she learned one of her 16-year-old's best friends tested positive for the virus.
We got a call from the school board saying that he was possibly exposed and needed to quarantine.
The next day,
he had a severely sore throat, red and sore. His glands were super swollen, a headache, fever and chills off and on for several days.
But despite his exposure and his symptoms, her son's school district didn't require a test.
They did not require us to be tested at all, just to quarantine.
Turns out when Florida school districts quarantine students or staff for possible exposure to the coronavirus, most don't require those in quarantine be tested, not even if they're symptomatic.
I just was kind of left on my own to decide whether or not he was well enough to go back to school.
The state has yet to publicly disclose the number of school cases of the coronavirus. Of districts self-reporting, hundreds of K-12 students and staff have tested positive since the start of school, with thousands quarantined around the state. In Marion County, since day one, the district has reported 58 positive cases, 287 students and staff quarantined. They can't return for 14 days and must be symptom-free. But testing isn't mandatory.
That is a decision that family makes.
Neighboring Alachua County offers free testing to quarantine students on day 3 and day 9 of their 14-day seclusion.
Why not make that mandatory for those people who have been quarantined?
Well, we're not going to force any parent to have their child tested. That is up to the parent.
And in Martin County, where its schools have reported 24 positive cases with 600 quarantined since day 1, the county health department told us in part the Centers for Disease Control and Prevention does not recommend universal testing of all students and staff.
It underestimates the problem and the prevalence of disease.
UF professor Dr. Frederick Southwick is an infectious disease specialist and advocate for rapid tests in schools. He says without testing those quarantined, schools are fueling a statewide undercount of cases.
Therefore, you underestimate the danger of keeping the schools open.
Florida's teachers union, which has an ongoing lawsuit with the state for mandating schools reopen campuses amid the pandemic, agrees.
The governor has said he wants to do less testing. And we've seen that in the numbers. We're seeing less tests occurring. But less testing means you're not getting in front and preventing the spread of COVID.
Amanda Bryce had her son tested. He was positive. A case that would have gone unknown if this mother followed school protocol and not her own instinct.
If you're requiring people to stay home because you think that they've been exposed, then I think that they should be tested before they're allowed to go back in.
Florida's Department of Health recommends all symptomatic students and staff get tested, but also adds students can return without a test as long as they stay home for the appropriate duration and all symptoms have subsided.
Tonight to the Florida lawmaker who is now reacting to an I-Team investigation earlier this week. Investigative reporter Katie Legrone uncovered some school districts are not counting COVID-19 cases involving some of its students. And tonight that lawmaker is demanding change.
I think it's irresponsible of us if we're not counting all cases.
Florida Representative Chevron Jones reacts to a recent discovery we made that shows some Florida school districts are not including all positive COVID cases involving their students and staff.
The last thing we need here in Florida is to lie about our numbers.
We revealed how several school districts are excluding the number of students and staff members who test positive after being quarantined from campus.
The school considered him an at-home case.
This Polk County mom still can't get a straight answer on whether her son's case will be included in the district's totals. Her son was quarantined because of a case at his high school. A few days later, he tested positive. A district spokesperson told us unless the student had close contact with others on campus and the health department determined further quarantines are necessary, students and staff members who test positive while in seclusion are not included in the school's total count of cases. Same in Leon County and in Miami-Dade County, where high caseload has forced the delay of brick-and-mortar schools for another few weeks.
That's the direction that Miami-Dade County School is looking to go to. I really hope that they reconsider.
Jones represents parts of South Florida, where Broward County schools and Palm Beach schools are among the districts who told us they do include the number of individuals who test positive while in quarantine from school.
We have this total inconsistency of how we are tracking COVID, how we reporting COVID, and it should not be this difficult.
Jones believes the bigger problem rests with the state. To date, Florida's Department of Health has yet to make the number of school cases public, leaving districts to post their own numbers using their own guidelines.
The leaders at the top, they have to begin to give direction that trickles down to the 67 counties into these school districts so they can get direction. If no one has direction, everyone's going to do what they want to do, and that's what's happening right now.
Despite the governor's promise to make school case numbers public, it remains unclear tonight when the State Department of Health will carry out his directive. For the first time, daily school logs are revealing just how difficult it is for schools to track the coronavirus on campus. These school district spreadsheets expose the realities of what schools are dealing with on a daily basis while trying to educate students in the classroom during a pandemic.
It's challenging. We had no idea what to expect.
The reports provided to us by 4 school districts through a public records request are daily logs submitted to Florida's Department of Education detailing confirmed cases of COVID-19 on campus and its impact.
Every day is a challenge.
In Okeechobee County, the district's population is small, just 6,400 across 10 schools. But daily COVID logs to the State Department of Education show small isn't immune to virus challenges. Take the teachers who test, but don't tell until days later when the results are positive.
If there's any kind of miscommunication, then that just kind of could hamper what we're trying to do.
Or the positive student whose doctor, according to school logs, never told his parents to keep him home or even contact the school. That one student forced 30 to be quarantined.
We literally go through each class period. We go through bus rosters. We just try to make sure we're not overdoing it, but we don't want to underdo it either and then lead to more sweeping.
Daily temperature checks, constant monitoring, and seating charts have helped overall numbers stay low in the district.
We don't want to have one person be responsible for sending home 100 students or staff or anything like that. So that's what we're trying to avoid.
Which is exactly what happened within the first week of school in St. Lucie County. Football teams at 2 schools impacted.
All of those players were quarantined for 14 days, and many of the coaches as well. There were no additional positive cases from either one of those.
In Pinellas County, one student case also impacted the school's football team. 41 students quarantined. In Polk County, a teacher's case forced more than 120 to be quarantined. As school district leaders, their biggest challenge:
just make sure that we're getting it right.
Less than half of St. Lucie's district student population is back on campus. As of last week, it reported 35 positive student cases, with 480 total students quarantined since day one. That is what they know about. Like any district, if the coronavirus has taught nothing else on campus, it's that trust is everything.
I have to protect, and each one of us have to protect our children and our staff members. And so we have to be very, very honest, very trusting, and very, and tell it like it is.
Meanwhile, our I-Team has found some school districts are seeing more school nurses leaving.
And I-Team investigator Katie Legrone shows us how the pandemic is playing a role and what districts are doing to fill in the gaps.
They are the first line of defense against student illness and the spread of sickness at schools. But across the state, school nurses are still in high demand, and in some cases, even shorter supply.
School nurse shortages are nothing new, not here in Florida or anywhere else across the country. But with the number of COVID cases now on the rise, some Florida school districts are dealing with a double whammy. More cases, fewer school nurses.
In Manatee County, over the first 10 weeks of school, a dozen school nurses have left. More than 10% of the district's nursing staff.
It's more than we would like.
In Pinellas County, 13 school nurses are now gone. And in Palm Beach County, 43 school nurses have retired, resigned, or took a leave of absence since the beginning of the school year.
Every year, districts lose school nurses.
Catherine Burge is a school nurse in Hillsborough County and president-elect of Florida's Association of School Nurses.
The numbers don't surprise me. They're probably a little bit higher this school year.
According to the most current statewide data, which is 10 days old, Florida's health department is reporting more than 1,300 COVID-19 cases on school campuses. While schools are largely proving not to be the super spreader sites some feared, schools short on nurses are finding it difficult to recruit amid the ongoing pandemic. For the first time, Pinellas County schools are relying on nursing agencies to fill the void while we look for a permanent replacement, according to a district spokesperson. In Miami-Dade, which recently reopened its brick-and-mortar option to students, the district is also working with staffing agencies, posting online an immediate need for a full-time, part-time, and per diem school nurses.
You're never going to have one RN in every school, although that is our goal. 2 schools, 3 schools is where we're all about sitting right now.
With some school nurses now being forced to cover more school ground, and the district's eager to find them some relief.
We've been able to replace the majority of those, but we're still looking for 5 more positions to fill. So if you know anybody out there that's looking for a position as a school nurse, send them to us.
As more schools reopen across our state, we wanted to know how many Florida teachers have chosen to leave the profession. And just this morning, we introduced you to a teacher who quit her job and started a virtual tutoring service over concerns about coronavirus exposure. But what impact will fewer teachers have on education? I-Team investigator Katie Legrone takes a look at the bigger picture.
As Florida teachers celebrate a legal win in their ongoing lawsuit against the state to keep brick and mortar schools closed during the pandemic.
We won because we're on the side of right.
Numbers we obtained from districts around the state reveal how the fear of COVID-19 may have already left thousands of teachers feeling like they've lost. In Tampa Bay,
over 99% of our teachers, instructional staff said they're coming back.
Hillsborough County, the state's third largest school district, is touting a near perfect teacher retention rate this year.
We've been really aggressive with our recruiting efforts to be able to create a longer, stronger bench.
According to school board documents, between mid-June and mid-August of this year, more than 1,000 teachers have opted for a leave of absence or resigned from the district, actually down 3% from last year.
You're always going to have a number of teachers, positions that you'll have to fill through attrition.
Around the state, just over a dozen school districts responded to our request for teacher retention rates. Many reported rates of 90% or higher, and typical, they say, of recent years. Many more told us they were still working on it or didn't respond at all. Typically, districts don't report retention rates until later in the year.
Hi, this is Katie Legrone.
During a Zoom press conference yesterday with the State Teachers Union, I asked what the union knew about teachers staying or going.
What we are seeing is in many cases almost double the number of teachers retiring and staff retiring that normally do at this point in the year.
The union also raising concerns about the number of teachers taking a leave of absence during the pandemic.
A significant increase in the number of teachers and staff taking leave of absences, in some cases more than 4 times what they would normally have at this point in the year.
While it's unclear if and exactly how COVID-19 is contributing to teachers leaving the classroom this year,
I'm concerned. I am very concerned.
Jeremy Blythe, a culinary arts teacher in Pasco County, didn't have the option, but he did ask to teach remotely and didn't get it.
It was just the health risk, the safety factor.
Now he joins countless other teachers who didn't have the means to leave, but also fear staying.
This is going to be like Survivor level, like figure it out, sink or swim.
6 weeks after most Florida schools opened their campuses to students, our I-Team has discovered hundreds of teachers around the state are still leaving, and we're just halfway into the first semester. Good evening, everyone. I'm Jamison Euler, anchoring from home tonight.
And I'm Wendy Ryan. Thank you for joining us. The I-Team's Katie Legrone has the numbers and the impact on your child's classroom.
All summer long, I thought that I was going back.
I used to think I was going to be a lifer.
They are Florida teachers who believe the mix of COVID in the classroom left them with no other choice but to flee from campus.
I wanted to make the decision that I felt was right for me.
For the past 3 years, Carolina Tave was deemed a highly effective elementary school teacher in Pinellas County. This year, she resigned just days before classes began.
I started hearing what was, the conditions under which I would have to work, and I didn't think that those conditions were optimal, were safe.
After spending 6 weeks trying to teach both in-person and virtual to special ed students in St. Johns County, Danielle Raposa decided to leave last Friday.
I was doing about 12 conferences a day in a 7.5-hour time span and expected to make miracles happen.
For the past month, we've combed through school district records around the state, seeking the number of teachers who have resigned, retired, or took a leave of absence since the start of school. We found hundreds. In St. Lucie County, 36 teachers dropped out halfway into the first semester, double the number this time last year. In Orange County, 118 teachers are gone, a 25% increase from this time last year. And in Hillsborough County, a district spokesperson told us they have 100 more teachers on leave right now versus a year ago. Not an unusual pattern, a district spokesperson told us in an email, adding they're not concerned.
It is not normal at all.
But the president of the state's teachers union is concerned. While there are various reasons why teachers leave in the middle of a semester, Florida's union points to the state's mandate to reopen campuses during a pandemic.
We know right now
that school districts have massive shortages. They had it before COVID. It's been increased under COVID.
But by how much isn't known. The union, which has a pending lawsuit against the state for forcing in-person instruction, typically tracks teacher shortage numbers, but hasn't been able to get a reliable count this year. In Pinellas County, a district spokesperson reports 32 openings for both instructional and non-instructional staff. And search teacher on Palm Beach County's district website, and you'll get more than 850 job listings. Danielle and Carolina have moved on.
I do not regret the decision that I made under the current conditions.
Both now work for the state-run Florida Virtual School after hoping to make the classroom work, but realizing this year the risks versus rewards.
You can only do so much.
We reached out to Florida's Department of Education for statewide numbers and any new efforts to try and reduce these separations during the school year, but have yet to hear anything back.
Florida's education boss just revealed schools still have hundreds of millions of dollars in CARES Act money to spend months after they were given the funds. So we wanted to know why they haven't spent it. I-Team investigator Katie Legrone is getting answers and discovers the education commissioner's words may be a bit misleading.
During a press conference with the governor earlier this week, Education Commissioner Richard Corcoran disclosed there's $500 million in CARES Act funding Florida schools have yet to spend.
We still have, I want to say, almost $500 million in unspent CARES funds for the districts. $500 million.
Which sounds like more than 100 days after being awarded the money, districts have collectively spent a fraction of the nearly $700 million allocated to them for products, services, and people needed to educate students amid an ongoing health crisis.
They're going to be able to plug those holes.
In fact, this spreadsheet provided to us by Florida's Department of Education shows nearly all school districts in the state have spent less than half its allotted dollars, with the majority still holding on to at least 75% of its CARES Act funds. Some have yet to spend a dime, according to the state.
It looks like school districts are really slow to spend this money.
It appears that way, but I will assure you that we are not.
This week, Pasco County Superintendent Kurt Browning found himself defending his district's spending habits, or lack thereof. Of the $14.5 million in CARES Act dollars Pasco schools received, the state shows the district has only withdrawn $2.5 million.
They'll say, you know, you got to spend that money. You got to spend that money. And we're going, well, we are spending the money.
The problem, Browning says, is a rule that requires districts front the money, spend it, and only then ask the state for the reimbursements.
Why wouldn't you just give us the $14.6 million? I mean, it's not like we're going to go to Tahiti on this.
In Lee County, according to the state, the district has spent less than 10% of its $22 million. But a school spokesperson said they're waiting for another $3.5 million in reimbursements. Same in Miami-Dade, the state's largest school district, awarded the largest cash flow of CARES Act dollars. On paper, the district has withdrawn less than 1% of its $120 million pot. But according to a district spokesperson, another $20 million is in the reimbursement pipeline.
We had the plan, so there really was no reason to sit.
Only a handful of school districts have spent most of their allotted funds. To date, Charlotte County Schools, a small district, awarded just over $3 million, has spent 70% of it, the largest percentage of any school district.
The less you have, the faster it goes. There's no question about that.
Some districts that appear to be slow spenders point to shifting priorities and changes in other funding for the spending delay.
We've probably spent more on PPE than I will tell you than we've ever had budgeted.
Still, Superintendent Kurt Browning remains concerned what looks like shy spending on paper could cost schools in the long run.
Legislators are looking at the amount of CARES dollars that aren't being spent yet. They're going to say, well, if you have $500 million sitting here, why do you need more money?
While some government agencies have until the end of this year to spend their CARES Act dollars, school districts have until the end of 2022 to spend the money. I'm I-Team investigator Katie Legrone, taking action for you.